Meanwhile, the Interfaith Council for the National Response on the Novel Coronavirus Pandemic has welcomed the lifting of the lockdown in 5 counties which were under restrictions, and particularly the resumption of in-person worship. However, the council is asking religious leaders to ensure that laid protocols are strictly adhered to keep the spread of the virus on check.
Yes, I know he's just around the corner.
The Interfaith Council supports the President's order to lift the lockdown. The leaders say they were relieved to resume in-person worship after a month away from worship places. The Council promising to ensure directives given to stop the spread of the virus are observed by faithful.
We are glad to note that the daily COVID cases have reduced. The prevalence rate fallen to around 12%. And even yesterday a bit lower than 12%. And the total COVID load in the country substantially reduced. We particularly celebrate that we can now resume in-person worship in these regions.
Among the directives with regard to places of worship, the Council said resumption will be in all regions and will strictly follow the 1/3 capacity rule to ensure physical social distancing and worship services that do not last more than 120 minutes. The Council also reiterated the ban on food in funerals and in worship gatherings, saying serving food aids in the spread of the virus.
The worship services should last no longer than 120 minutes. And that means we will have to organize several sessions to provide for the needs of each congregations where it is called for.
President Uhuru Kenyatta, during his Labour Day speech, announced relaxation of measures in the 5 counties initially put under lockdown.
It is human that people get tired, that many Kenyans are getting tired after such a long period. But it is our duty to keep this fight against the COVID enemy alive. Indeed, wars and battles are won by tired soldiers.
Meanwhile, the country has recorded 345 cases of COVID-19 from 6,686 samples taken in the last 24 hours. The COVID-19 positivity rate dropping to 5.2%. 24 people succumbed to the disease, taking the death toll to 2,805 since the pandemic struck.